Welcome to everyone. Thank you all for joining today. Welcome. It's nice to see you all joining. Welcome to today's Peer Recovery Support Services Community of Practice. My name is Brooke, and I'm pleased to introduce our topic today, supporting unhoused individuals and building connections and navigating resources. We have a great lineup of speakers who will speak for about an hour total, followed by about 20 minutes of open Q&A. So let's get started. Just some brief housekeeping notes. We are recording today's meeting, so we ask that everyone mute your microphone when not speaking, and also just be aware not to put any personal information in the chat. You're free to keep your cameras on. We love to see your faces. But if you prefer to remain anonymous, you're welcome to turn off your camera. If you have any internet issues, try turning off your video camera, or you can join by phone. If you're having any trouble hearing, you can expand the audio icon there with your Zoom tools and open audio settings. And you can select a different speaker or microphone there from the menu or adjust the volume. Here are a few notes about the Zoom engagement tools. We encourage you to engage using Zoom tools such as reactions and the chat. It is open for all to use throughout the session. And during the Q&A session at the end, you can hit the raise hand button and other reactions, and we'll invite you to turn on your microphone. Additionally, please be aware that certificates will be provided for attending today's webinar. Be sure to get your CEUs met by staying until the end of the session and completing the evaluation that will be shared before finalizing today's program. Now, without further ado, I'd like to turn it over to Troy Barnes, who will be introducing the rest of the session. It's all yours, Troy.
Thank you, Brooke. So first we'll go over our main objectives. The first being to identify and define available resources and how to use them effectively for unhoused populations. Then explore the best practices for conducting outreach among unhoused communities. And finally, discuss the successes and challenges of addressing resource gaps while providing support. And as Brooke said, we have three wonderful speakers today. Jennifer Chisholm is the Executive Director of the New Hampshire Coalition to End Homelessness, an organization whose mission is to promote long-lasting solutions to homelessness in New Hampshire through its three pillars: research, education, and advocacy. In this role, she authored the 2024 edition of the State of Homelessness in New Hampshire, an examination of the Granite State's homelessness data and trends, and expanded the coalition's reach into rural New Hampshire through a series of roundtable events across the state. Before her transition to systems-level work, Jennifer was a direct service provider for over 20 years in Manchester, focusing on supporting people experiencing homelessness and those with mental health and substance use concerns. In her last position, she served as the Behavioral Health and Outreach Coordinator for Manchester's Healthcare for the Homeless program, where she oversaw the team that provided case management, therapeutic, and recovery support services in clinic, in encampments, and on the street. She has worked extensively with adolescents, including as a case manager with the Transitional Living Program for young adults aged 18 to 21 who are homeless, and as a clinician in an adolescent substance use disorder treatment program. Since 2016, Jennifer has served as the adjunct faculty with the UNH Department of Social Work, where she teaches social work practice and field seminar courses to master's and bachelor level students. She also provides clinical consultation to a local school district student assistant program employees and who work with youth at risk of substance abuse. Erik Becker. Erik is a lifelong North Country resident, currently serving as Tri-County Communities Action's Housing Stability Program Director, encompassing shelter services and housing stability programs. He is congressionally recognized for his work with vulnerable populations, including youth, unhoused, and individuals experiencing substance use disorders, as well as other community-based endeavors. And finally, we have Dan Lavigne. Dan Lavigne has an extensive background in mental health and substance abuse counseling. His life's work has been dedicated to assisting others to become their best self, and he is a fierce advocate and voice for those who need it. Dan wears many hats. In addition to his role as program director and client coordinator for the Way Station, he was crowned 2023-2024 Mr. Mount Washington Valley, volunteers as co-host of Valley Promotions Charity Chatter, performs as Santa Claus during the Christmas season, and is an avid biker and family man. Dan is well known throughout the Valley and beyond for his devotion to his work, advocacy, and kindness. And with that, I think we're going to go a little bit out of order, and we're going to start with Erik today. So Erik, take it away.
Actually, Jennifer's here, so we can go in the programmed order. Go ahead, Jennifer. Thank you so much, Troy.
Wonderful. So sorry if I caused any panic. My morning did not pan out quite as I was expecting. So glad that I was able to scoot in before my slide. So good morning, everybody. So you can go to the next slide. Just a little bit more context before I actually start with my presentation. And so I just wanted to let people know, so I am not a person with lived experience, nor am I a person in recovery. However, my work has led me to work with a lot of people for a long time who have experienced both of those. And I've been a strong advocate for peers, peer support, and lived experience within the context of my work. So at Healthcare for the Homeless, I brought in the CRSWs onto the behavioral health team, which I was in charge of. And here at New Hampshire Coalition to End Homelessness, we have the Granite Leaders Program, which is a leadership program for people with lived experience in homelessness. So if that sounds interesting to anybody, reach out for next year's program. So next slide, please. So we're going to jump into some data, and you can flip to the next slide. For the coalition, we work from 3 pillars: research, education, and advocacy. And so what we're probably most known for in the state is the State of Homelessness in New Hampshire report. And so this was released in December of 2024. It covers 2023 data because we're always a year behind. So we've just gotten the 2024 data to crunch for our 2025 report. And so there's 2 sources of information that I always like to explain. There's the point in time count that I'm assuming people are familiar with, but it's that like 1 24-hour period in January. So a real snapshot of what's happening on one day in the winter. And then the Housing Management Information Systems, or HMIS data, which is year long. So it's just more robust numbers. You'll see larger numbers there. And so they both are unduplicated counts to the best of our ability. And I will say that it's important to think about who's counted and who's not counted. So this is by the HUD definition of homelessness. So it's only people, it's not counting people who are doubled up, which we also know is just like a large, oftentimes unseen group of people experiencing homelessness. So that's not counted in the numbers that I'm about to share. So go ahead. So this is an overview of the 2019 to 2023 point in time count data. So that's that January one night. And so quickly looking, so the dark blue is the most recent numbers, and you can see that there was an increase in every subpopulation and overall in homelessness in New Hampshire in 2023. And except for veterans, which was really exciting. So there was a 20% drop in veterans. And so we do know, if you go to the next slide, that in 2023, New Hampshire had the highest percentage increase in homelessness in the entire United States, out of every state in the nation. So the United States overall saw about a 12% increase in homelessness, and New Hampshire had a 52.1% increase. In 2024, I have seen those numbers, and so it went down about 8%, which is great. And 2025 preliminary numbers just got released, and unfortunately, it went back up again. So I haven't been able to crunch those numbers yet because literally I saw them this week. But so we did a little bit of a dip, and it looks like we're going up again, unfortunately. If you go to the next slide, if we look at the year-long data, in all subpopulations in 2023, we saw an increase across the board. For veterans, we think that that's because there actually was an increase in services available and eased eligibility criteria for programs so that more people were drawn into the programming rather than an actual rise. So hopefully we're right about that. So next slide, please. When we look at that year-long data, in 2023, a total of 6,806 New Hampshire residents were homeless in 2023, which was about a 50% increase from 2020. And so just to put it in perspective, that number, that 6,800, is larger than the population of either Plymouth or Meredith. And it's actually more if we took all of the people experiencing homelessness that year in New Hampshire, it would be larger than 80%, over 80% of the towns in New Hampshire. So it's a significant number for our state. Next slide. When we look specifically at unsheltered homelessness, which is living in a car, a tent on the streets, but first I was like floored in a good way because from 2022 to 2023, we only saw a 2.1% increase. So only 7 more people from one year to the other. So I got really curious, and the 2024 numbers, preliminary numbers were out. So I thought, oh my gosh, let's look at that and see if the plateau continued. So if you look at the next slide, unfortunately, it didn't. So we had 2.2% increase from 2022 to 2023. And then we look at 2024 and we saw a 71.3% increase. And so what that means is that between 2019 and 2024, in the point in time count numbers, those January numbers, the number of people experiencing unsheltered homelessness in the state has almost quadrupled, which is just a really scary and heartbreaking number. So if we look at unsheltered homelessness with the year-round data, we saw a big increase across the board from 2022 to 2023. So we saw an over 60% jump. So these aren't small numbers that we're talking about as far as percentage increases. And so unfortunately, that didn't plateau. This is the more comprehensive data set because it covers a whole year. So next slide. For this presentation, I pulled some numbers just about mental health conditions and substance use disorder. And so this is the number of people in the point in time count that self-reported having, again, either a mental health disorder or a substance use disorder. And so over time, you can see that it's definitely increased. So more than doubling for mental health conditions. And interestingly, substance use disorder isn't quite as high. So I hope that that's significant. And so some people will say, well, you don't really know what the real numbers are because it's self-reporting. And so are people going to tell the truth? And so we just sort of work under the assumption that if people are misreporting for one reason or another, then they're doing it at similar frequencies from year to year. But so in 2024, about 40% of people were reporting a mental health disorder, and a little under 30% were saying that they had a significant substance use disorder. So the next slide. I just always like to briefly talk about the fact that affordable housing is a leading contributor to the rise of homelessness in New Hampshire. And so we can take a look at the math on the next slide. And so in 2024, according to New Hampshire Housing, the median cost of a 2-bedroom across New Hampshire, and you can look, they have a really great rental survey that you can look at on their website if you're interested in more regional or county data about this, but statewide, a 2-bedroom apartment cost about a little over $1,800. And so in order to afford that, you would need to make $73,300 a year. And so when I say afford, I mean that HUD definition of you shouldn't spend more than 30% of your income on your housing. Unfortunately, the median renter household wage in New Hampshire is, like $15,000 to $20,000 short of that. And so the math just doesn't add up. And so then we also looked at the number of hours a week somebody would need to work at minimum wage to afford that median 2-bedroom rent. And so you would have to work 194 hours a week in order at $70.25 an hour in order to afford that. The challenge being that there's only 168 hours in a week. And so the minimum wage just makes no sense. So the math, again, just doesn't add up. So we so we did roundtables across the state. We did 10 different ones in more rural parts of New Hampshire. So not Manchester, not Nashua area, but everywhere from sort of Lancaster and Littleton to Lebanon and Keene out to the seacoast and in between. And we just heard a lot about the unintended consequences of the emergency rental assistance program and the like bump up in rent that we saw from that. So people were talking about clients with rents, and I experienced this as a case manager too, raised up to literally $700 a month during that time. So it's just scary. So next, and never mind with inflation and everything on top of that. So speaking of the roundtables, just to speak about successes, we went in asking what's working well and then what are the challenges. And so really the big thing that people talked about, and this won't be a surprise to anybody on the call, is just the amazing collaboration that's happening between agencies and just keeping conversations and communication open. And I'm sure that Erik will be talking about that because he is a superstar at that. He attended at least probably 3 of our roundtables in the North Country, which we really appreciated. He just brings so much to the table. And for challenges, one of the things that we really heard about was subpopulations that were hard to bring enough resources to. So we heard a lot about aging adults and people who are medically frail, people discharging from hospitals, both from physical and mental health admissions. And then we really did hear a lot about people in need of recovery support or who are actively using substances. And being able to bring them the right resources to meet their needs and where they were at any given point kind of in their recovery journey. So next slide. A lot of conversations about needing resources in people's communities. You know, connection is such an important thing that we want to be able to keep people in their own communities. So another piece of the research that we've done is just around the city of Grants Pass, Oregon versus Johnson decision and the encampment disruption that has been happening from that. And so just a quick sort of overview. So in June of 2025, the Supreme Court made a decision that allows municipalities, cities, and towns to make laws or ordinances that allow the criminalization or the fining for sleeping on or camping on public land, even when there's not emergency shelter available. And actually, and this is like not great optics for our state. So New Hampshire had the first municipality in the nation to make changes to the ordinance, like once that ruling came through. So I was actually contacted by and did an interview with a National Criminal Justice Journal, who was just like, why did they make these changes so quickly? So it happened 2 business days after the decision was official. So, you know, New Hampshire was on the map in just an unfortunate way when we think about homelessness and the needs of people and its practices and support. So next slide. And so again, not a surprise probably to anybody on this call, but we did some literature review just about what the research says about disruption of encampments. And so it has, you know, some pretty intense effects on people's mental health and well-being, including this whole list here that I don't need to read to you, and you could probably tick them off, you know, but anxiety, depression, sleep deprivation, you know, that just like connection and dehumanization, and also increases, they found, a risk of violence and mental health crises, and really disconnected people's connections. So whether that be to physical health care, mental health care, recovery supports, MAR or MAT, or just, you know, meetings and things like that. And then there was also just a loss of physical supplies too. So people being moved would, you know, lose their stuff, which is a lot of money, not only for people to try and replace all of their things, but also for municipalities and for the nonprofit agencies who are providing things like tents and blankets and things like that. And so for just an amazingly vulnerable group of people, again, it's just heartbreaking. So next slide, please. So we did, and again, probably this isn't a surprise, but we also did a series of interviews with New Hampshire providers just to hear their perspectives of what was happening in New Hampshire specifically. And so it ticked all of the boxes of, you know, what the literature was saying. And so this quote is in the middle of the the state is a quote actually from a police chief who said, people are told to move and ask where do we go, but there's no answer to give them. And so, we have a lot of empathy as the coalition for law enforcement as well, who are just put in a situation where they're asked to uphold the law and don't have resources when people are asking, well, what are we supposed to do? Because there's just no great answer, sort of what we're hearing most communities across the state. So if we go to the next slide, this is an example of like a real life example of how encampment disruptions have affected in Manchester. So I'm down in Manchester. So I was speaking with the Andrew Warner, who I'm presenting with in a different community of care or community of practice tomorrow. And so he was pointing out that they've noticed that there's been a scattering of overdose sites in the city with the increase in disruptions. So there's repeated disruptions, people spread out and they lie low because there's a lack of trust that happens because, they are like, oh my gosh, like if I share this information about where I'm staying, it's just going to get out and then we're going to get moved along. So that really leads to a disconnection from service providers. And so then the prevention efforts have had barriers put in place. And so the overdose locations aren't as predictable. And so it's really scattered site if you look at the map. And so, at least in Manchester, there's been, if we were to take a look at this issue differently and find a different solution for it, then it would be literally life-saving. So next slide. So what can we do about it? So I work from I do systems work now from kind of the macro perspective, right? So that 30,000 foot, and, I'm sure that Erik and the other presenter will have some really great, sort of direct practice ideas for people. But this is some stuff that we know of that we are trying to educate decision makers on, policymakers in the state. So if you go to the next slide. So speaking about evidence-based approaches with working with encampments, there are resources that if people are doing outreach, I would encourage you to take a look through, get to know them, and then be able to advocate for them within your own communities. So the U.S. Interagency Council on Homelessness last year put out the 19 strategies for communities to address encampments humanely and effectively. And so that actually has been officially adopted in New Hampshire by four different groups. So the 3 different continuums of care, so Balance of State, Manchester, and Greater Nashua have all adopted it, voted in officially as a guiding document, as has the state's new Council on Housing Stability, which is a really great step. So the next step is, again, sort of just like getting more people to become familiar with it and really buy into it and follow it. And I have a summary of that on the next slide. But the National Alliance to End Homelessness, you don't have to go back, that's fine, also has a really great interim strategies document that talks about best practices for working with people who are staying out. And, one of the messages that I really talk about when I'm doing presentations or public education or talking to legislators is that it's great to know that housing is the answer. And so that development is really important when we think about our housing inventory in the state. But people are homeless now, like people need answers now. And so that we really do need to have interim strategies in the time between, this moment and when we're going to actually have enough affordable housing for people to live in. So if you go to the next slide, I highlighted in that kind of like puke green yellow. Sorry for the color, that's actually kind of gross. But places where peer support can like really sort of easily kind of fit into, right, those puzzle pieces. So engaging residents in efforts to develop solutions. The voice of lived experience needs to be part of the answer. That voice has to be at the table because they know what works, right? So I, not having the lived experience, can think, oh, this looks great on paper, but somebody with lived experience can come along and say, I can tell you 5 different ways that just falls apart in the actuality of trying to implement that as a solution. But so that cross-agency, multi-sector response, pulling together the interdisciplinary teams and outreach teams. So probably a lot of you are involved in outreach in one way or another. And that outreach teams really need to lead the effort because they're going to know the experiences of the people much more intimately because they're there. So, one of the ways that I see peer support, just sort of in general, is really bridge builders. And it's just an amazingly integral part and like keystone for this work. And so if we look at prevention to like just interrupting the pipelines to homelessness and building strengthening safety nets, like safety nets is what it's all about. And connection, I think that in my experience working with the CRSWs on my team and people with lived experience in the Granite Leaders program, that is just a huge skill set, of just building that connection. So next slide. So here are some other best practice strategies. And I'm looking at my time. I think I have 1 minute left. So I will leave this for people to review. But I would say that centering the work on a foundation of harm reduction is something that is just really hard to explain sometimes to people who don't understand it. But that, again, it's just so foundational in the work because we truly have to be able to meet people where they're at. And then addressing stigma as well, whether that be through public education or just one-on-one conversations with your clients, colleagues, family, friends, neighbors, anybody who will listen. And then for the assessment, just being able to really identify the specific needs of a specific region. And if you're a person with lived experience, I highly encourage you to connect with us to elevate your voice. If you're somebody who is interested in honing those skills, again, come and find me. Like we have the Granite Leaders program. It's a compensated program. People are paid $300 to complete it because we want those voices to be able to explain to people what the needs are in the state. And so I will say that the rest of my slides, because I hope that this slide deck will be moved out, just contains some additional tools about decision making in tough times. So yeah, thank you so much for the opportunity to talk to you. Here's my contact information if people are interested. And I know that Erik Becker from Tri-County CAP is up next.
Awesome. Thanks, Jennifer. So good morning, everyone. My name is Erik Becker. I'm the Housing Stability Director for Tri-County CAP. We are a community action agency that covers about half of the geographic region of the state, all of Grafton, Carroll, and Coos County. And I'm here to talk to you both about the activities that we do as a department and focus on housing and homelessness, but also some philosophy that I want to share with you at the end. Next slide, please. So our housing stabilization program really are two sides to one coin. On one side, we have our shelter services, which are broken out into a few different programs and brick and mortar sites, as well as our regional access point for 211. And then the other side being some of our housing programs, including permanent supportive housing, housing stabilization, ESG, so on and so forth. Next slide, please. So for emergency shelter, it's really, I also just want to put one side note. Wherever you guys are in the state, there's somebody doing this work. And so even if something is offered a little bit differently and you have a question, just reach out to me afterwards and I'll get you in touch with who's doing it in your area. This again is directly relevant to Grafton, Carroll, and Coos County, but similar things are happening elsewhere. Every region of the state has a regional access point, for instance, so on and so forth. But as far as what's under our umbrella, we have 3 shelter programs: the Cold Weather Shelter Program, Tyler Blaine House, and the Birch House. Next slide. Currently, Tri-County CAP covers Grafton and Coos County with the Emergency Cold Weather Shelter Program. The Way Station and Dan hold the contract for Carroll County. Everyone in the state does it a little bit differently in their own region. So again, like what I'm about to say is relevant for what we're doing in Grafton and in Coos as far as that program. Really 2 main parts. We provide emergency cold weather gear and supplies to folks who are unsheltered in emergency. cold weather situations, but also that's being expanded to really emergency weather. So too hot or too cold, which I'm really excited about. I think that's very prudent. But also our model is to contract with local municipalities. All municipalities have a responsibility under RSA 165 to provide emergency shelter. And so we kind of sweeten the deal for them where we will reimburse them for putting folks up in those emergencies. So if there's a blizzard and there's somebody who's in their car and they say, hey, we're supposed to get 2 feet of snow and he's using his car to be warm, and that's going to be a carbon monoxide issue or any kind of issue like that, and they put them in a hotel, we'll reimburse them for that. If you are running into a town who is not being helpful with somebody, please refer them to 603 Legal Aid. They dedicate days to specifically making sure folks get the town welfare assistance that they're entitled to under the law. Next slide, please. And then the rest of shelter services is divided between our two shelters. I'm currently at the Tyler Blaine House in Lancaster, which is an 11-bed male facility. We also can take an intact family if space allows. It's kind of a first come, first serve thing. So if I have a mom, dad, and 3 children, I'll put them in the family room, and that leaves me 6 beds. Or conversely, if there's more single males and no families presenting, then I'll just use the space as needed. Then we also have the Birch House in Bethlehem, New Hampshire, which is a 15-bed women and children's facility. It's actually a beautiful kind of long farmhouse that is pretty secluded. It's just a beautiful property, especially in the spring. And a little bit about our shelters. All are dry. If somebody presents as being under the influence, we certainly work with them to the best of our ability. If somebody comes back intoxicated and it's a situation where, they can, for lack of a better word, just chill out and then go to bed and not be violent, then that's one thing. But if somebody, starts smashing things, that's a safety is something we put above all else at our spaces. Both shelters are low barrier, but that does not mean no boundary. They both have a certain set of rules and expectations for both, and again, safety being the big thing. And both shelters provide on-site case management and have fully stocked food pantries that are accessible to our folks. Next slide, please. As far as shelter access, and this is again relevant to our shelters, the rest of the shelters in the state that are state funded are more or less similar. But prior to entry, we do a phone assessment. There is no set length of stay. Folks can stay here as long as they are safe to be here. But we, under SGIA, which is our main state funding and state granted aid, we're not allowed to mandate case management. So we use motivational interviewing to increase buy-in. And so we really hope that folks are working towards something at the rate that they're able to work towards something. Something like Social Security takes 9 months, or there's, depending on how folks present, there's certainly some built-in lengths of time that they're going to be working on stuff. And then as far as disqualifying factors, we cannot accept arsonists or sexual offenders. And violent offenses are handled on a case-by-case basis. For instance, if somebody was in a bar fight 15 years ago, while they were in the throes of substance use, and that's certainly quite a bit different than somebody who has done murder and other things like that, or somebody who gets simple assault every 3 months. That's more of a pattern of behavior that we would be concerned about. Next slide. And now this is really important and really relevant to everything, whether in our area or in the area that you work in. The regional access point is where the information, when any one of your constituents, when they call 211, that's where that page goes. We are one of the few places in the state that operate that as a brick and mortar versus it going to an outreach worker. Which means that our response time is quicker. It also means that staff are closer to a computer and can kind of do the key functions of coordinated entry and response quicker. Also elsewhere in the state, I don't know of anyone else that does it the way that we do, where we are the shelter resource, we are the coordinated entry and regional access point resource, we are the housing stability services all in one team. Usually that's 2 or 3 different phone calls. So we're also able to do things a little bit quicker. So someone calls 211, they gather some information and staff respond to that call for anybody who's reporting homelessness in Grafton, Carroll, or Coos County, or housing insecure. And anyone who is homeless or unsheltered, or an emergency shelter for 14 days is eligible for what's known as a coordinated entry assessment. And that is a linchpin for so many services that I'm about to get into, but there are a number of services such as PSH, ESG, rapid rehousing, different things across the state that can only be accessed by a score on the coordinated entry assessment and referral to the community queue that the state holds, that then based on folks' score, their vulnerability index, the higher they score, the higher on the list they are, and then they're at the top of the list, they get referred to programs that are eligible to them. And then there's sub lists for veterans, folks experiencing domestic violence, and now youth. Next slide, please. And so to tie into that, all of these programs, these COC continuum of care programs, require a referral from that prioritization list. So that's why coordinated entry is so important. That's why if you are doing outreach or you are working with an unhoused participant, have them get in touch with their regional access point to get enrolled, but then also get assessed, because that's just a list that you want to be on. So we operate the following COC programs: permanent supportive housing, youth permanent supportive housing, which is super new to us, ESG prevention and rapid rehousing. Next slide, please. So PSH is a super cool program. It provides ongoing income-based assistance for extended periods for people who qualify for the program. So as far as qualification, they have to, again, be scored in coordinated entry. They have to be chronically homeless, which is 12 months of emergency shelter or unsheltered homelessness in a 1-year period, or 12 months in a 3-year period. And they have to have a verifiable disability. So it's really designed for our most vulnerable folks. That program provides ongoing case management. If they have no income, they don't pay anything. If they have, as their income increases, hopefully, they pay a portion. And very rarely folks will stabilize so much that they're making so much money that they just graduate the program and don't need us anymore. But that usually is pretty rare. Youth PSH is very similar, except they're not requiring that chronic homelessness status. So a young person just has to have that referral and just has to have that verifiable disability. And they have to be between 18 years and their 25th birthday. Next slide. ESG and rapid rehousing. ESG prevention, which is designed to keep folks in their apartment, does not require a referral, but they do have to score a certain threshold on the ESG screener that's related to rental arrears, and does also come with ongoing case management. And then the other part of that program, ESG rapid rehousing, we typically have 3 slots for that. It requires a referral from the state, and then that provides up to 9 months of assistance, usually on a tiered basis. The most assistance for the first 3 months, and then less for the next 3, and then a lower amount for the following 3. The difficulty with that program is HUD requires us to be within fair market rent, which is very hard to find. So it's hard enough to find an apartment, but now we have to find one within a certain income price bracket. So that we've had some challenges with that. And then we also have ESG quote unquote outreach, but that's typically a line that we use to buy supplies. So we have a ton of outreach supplies, larger tents, cook stoves. Dan, this is the stuff I was telling you about the other night at the annual gathering, but cots, things like that. So really excited to get those out to folks. Next slide. And then housing stabilization is the one housing program that is not HUD funded that we have. It's a state funded program. We use the same screener as the ESG prevention, but the threshold is less. And the reason for that is because the hope is using that same tool. If somebody scores between 20 points in the ESG threshold, then they'll go into housing stabilization. If they score over the ESG threshold, they're in prevention. Again, we try to run that as a slotted program. We do some one-off, security deposit, move-in costs things, but we do try really hard to make sure that folks are getting that ongoing stabilization case management. So typically, if it's a one-off, say somebody just needs a security deposit, we'll still follow them for at least 30 days, and then about half of the time we find out that it's like, oh, you could use a little bit more, and then we get more involved. The goal is really to make sure folks are able to sustain. We do everything from helping them connect with fuel assistance and other mainstream benefits, but then also working with if they're in income-based housing, making sure that they've reported all the changes of income that make sure that they're required to pay what they should pay based on what they're receiving for income. Next slide, please. Okay. And so when Troy invited me to be a part of this today, this is was at the top of my kind of pile of ideas on what might be relevant for all of you in interacting with me and those like me across the state. And we've coined that kind of two-way trauma-informed communication. One of the biggest barriers in this work on my end, and I'm sure on your end, is communication. On our end, anytime we're receiving federal funds, there's strings attached. There's questions that need to be answered. There's information that we need to gather. And accurate information is really key in order to make appropriate referrals. Because the last thing I want to do as a provider, the last thing I want my staff to do is to send somebody to a door that is not open to them because of something we don't know. Next slide, please. One of the things we're running into is we're seeing more and more rental applications that have hold deposits. These deposits are, if they're paid by us, they're either paid by us or the participant, and they're forfeited if the information provided on a rental application is found to be misrepresented or false. The most common, two most common things, one evictions, that's not a really big thing, but then criminal history is also one that has been causing these to get kicked back or fail. And we like I said, we don't want to send anybody to a door that isn't open. My philosophy is, wouldn't it be better if we can create a relationship of trust like the way that your participants have with you? And I know that's harder because we're just the resource sometimes on the phone or filling out an application with them. If we can find out a way to kind of get everything out on the table and pick that apart and say, okay, here's the things that might be barriers, let's figure out how to get around them. It's a lot easier to navigate those if we know that they're there. Next slide, please. It's completely understandable to me that that anyone who has any kind of past, which we all do, may be reluctant to divulge that to a stranger. And that's why peer support is so important, because I think it's a lot easier to talk to somebody you feel has shared experience and kind of is in it with you. And that's why all of us need to show up human and whatnot. But next slide. what we can do is be more open about the information we need and why we need it. Because again, it's never a matter of like, oh, I just want to be like, gotcha, or I want to screen you out of something. It's about, I have things that I'm held to, and others have things that they're held to, and we really want to make sure that we're making the most appropriate referral possible. One great example of that is anytime somebody's referred to any of our programs, and sometimes those folks are from outside of our area, and looking to be moved into ours, I like to have a conversation with the caseworker and the participant, especially when it's it's clear that there's some other things going on. I feel like substance use is a prime example of that. And we recently had a situation where somebody spoke to us, presented fantastically, but also is somebody who gets command hallucinations and is in the throes of substance use. Did not relay any of that to me, but I just said some things like, for instance, I want to make sure that what are some things that you need in the community that you're looking to move into? What are the other things that you feel you could get support in? They mentioned mental health, but when I got off the phone, they turned to their caseworker and said, hey, I really want to go to treatment for substance use. Not something he was comfortable sharing with me, but something that he recognized that he needed. And so I guess, not that I'm in a position to give any of you marching orders, but if I could make an ask, encourage participants, especially those you've developed a rapport with, to be open and honest, so that we can identify pitfalls together, whether it's the three of us, the two of us, whatever, and then come up with a plan from there on how we're going to address those things, so that I'm a firm believer on the warm handoff. I like being able to say, hey, don't go to the way station, go see Dan, for instance. Go see this person here that I know and can vouch for. Like, there's a ton of value in that, but also being able to then drill down and say, okay, this person needs to go see Jen Goulet at the consortium to see when their next annulment clinic is, and really identify and target those things that are barriers, so that they're not holes that folks have fallen into. Next slide. That's me. So to turn it over to Dan Lavigne.
All right. Hey, everybody. Welcome and good morning. Everybody hear me okay? Yes. Okay, good. So I'm Dan Lavigne. I work for the Way Station here in North Conway, New Hampshire. We're a very, very, very small nonprofit, probably the smallest one doing the scope of work that we do. We have currently one full-time employee and two part-time employees. Our full-time employee is me, and I am responsible for all aspects of the day-to-day operations, resource coordination, interagency and business collaboration, client outreach, you name it, anything having to do with talking with, providing clients with things, that's me. We have a development director who's responsible for making sure I get paid to do what I do. And we have a part-time Circles Mount Washington Valley coordinator, which I'll talk about in a little bit. Today, I'm going to be talking about some of the successes and challenges of conducting outreach among the unhoused populations in rural communities. Next slide, please. Now, a lot of you may understand what the Way Station is. You may be familiar with us, but some of you may not. So I'm going to go into a little bit talking about what the Way Station is. As I mentioned, we're a very small organization with one full-time employee. We're located in North Conway, but we also have mobile outreach to Ossipee currently. We're responsible for providing services to Carroll County and surrounding areas. We do go into Maine a little bit. Some of the services that we do provide are gas cards, laundry cards, phone cards, phones. Phones and phone cards were determined to be one of the most important vital resources that most of the unhoused populations do not have but necessarily need. So we make sure we get them to them. Camping gear, clothing, toiletries, stabilization vehicle repair, and utilities fund, which I'll go into in a little bit. non-perishable foods, non-food items, pillows, and bedding. Conway residency, which I will talk about in a second as well, mailing address and referrals. Next slide, please. So we have four pillars of the way station and what we do. The first is housing. We currently have a very active group of board members that are working on trying to establish housing. We were granted a HUD fund, a CDBG grant last year, which we're not sure if we're going to end up getting now, but if we do end up getting that, it's going to allow us to change our physical location into a location that will house 3 transitional living units. I believe up to 9 people would be able to stay there for up to, I believe, 6 to 9 months. I'm not sure. One of the long range goals that the board members are working on is a 24-hour short-term housing, emergency housing facility. That's something that's going to be way off in the future. Our community is not embracing that as well as they are the transitional living. We have operations pillar, which again is pretty much what I am responsible for, which is the day-to-day operations, all client interactions, coordination of resources, coordination with other agencies and businesses to ensure that our folks get what they need. Poverty mitigation, that's where our Circles Mount Washington Valley comes into play. So Circles Mount Washington Valley is a chapter of Circles USA, which is a program designed to be kind of like a peer supportive program helping where folks would be helping each other kind of move to that next level of success, whether it be out of poverty or just, trying to reach that next level at work, perhaps, or, trying to learn how to save money, balance checkbooks, all the things that kind of keep people where they're at. So how it works is the circles will develop a cohort, and that cohort will be of anywhere from 4 to 9 people, and they will work together along with what's considered like mentors from the community or stakeholders in the community that will come in and kind of help usher them through. I don't really work a lot in that program. We are trying to find a gap program to go from unhoused to circles eligible, but that's taking a little bit of time. We also have an economic stabilization, which I had mentioned in the previous slide. That is our stabilization, vehicle repair, and such fund. That is a set amount of money that's set aside in order for us to help people stave off things like eviction. Many low-income housing units, if you lose your electricity for a certain period of time, you face eviction. So we're able to utilize that fund to help people get their utilities turned back on. Many of our folks live in vehicles, so we're able to use that fund as well to help for vehicle repairs and so on to be able to keep them on the road. Currently, we're talking about expanding that to help one client in particular with pregnancy leave or child leave after she gives birth, which is going to be really kind of neat to be able to provide that so that she doesn't have to worry about falling behind in her rent. Next slide, please. So currently, Carroll County is ranked the 4th largest county by land mass in New Hampshire out of the 10 counties that we have. We encompass 931 square miles, but we are also ranked the 7th out of the 10 by population with roughly only 44,000. According to the last census, that breaks down to about 55 estimated housed residents per square mile. That doesn't account for the unhoused population. Carroll County is one of the only counties in New Hampshire that has no emergency shelter for the unhoused population or public transportation. TRICAP does have a shelter available in Lancaster, which is often full and out of the reach of our folks. And TRICAP is also expanding their transportation services, which is going to be amazing for us. We just lost our only taxi service to the casino. So that's going to present some challenges for us. Next slide, please. So these statistics are statistics I gathered based on the work that we do. They are specific to the way station and the community that we serve. Of the 400 clients we serve, 135 adults and 14 children are unhoused currently. Unhoused, meaning they either live in a vehicle or a tent or a three-season camper that is just substandard living, unless it's this kind of weather. Let's see, I'm sorry, 91 adults and 10 of the children are with transportation. 44 adults and 4 children are unhoused with no transportation. Now, I want to talk a minute about that. Going back to the last slide that we looked at, we have 55 housed residents for every square mile. We encompass 931 square miles of New Hampshire. Anybody familiar with Mount Washington Valley, North Conway area, we're not an urban area. We're very rural. If you have no transportation here, it's next to impossible to really get anywhere. And I want to reflect back to something Jennifer had spoken about earlier, which was Grants Passage. It is legal for people to camp in the White Mountain National Forest. However, the nearest legal camping space is roughly 11 miles out of town. And for somebody carrying everything they own on their back, that's a big ask. We have 4 adults living in vehicles without transportation. Those are vehicles that do not work. Oftentimes they'll be parked on a friend's property, a family member's property, and they just sleep in the vehicle. We have 8 adults and 5 children living in RVs or substandard campers, and 18 adults and 2 children living in tents. Now, this is year round. Oftentimes what will happen is families will take in homeless folks with children during the winter time, but we did experience some issues last winter where we had several families that were unable to find housing for the winter, and we really worked with them, as Erik had mentioned, with our end of the cold weather program, getting them into housing during the very deep of the inclement weather. Next slide, please. This goes a little bit more into detail about the numbers and what we're kind of really looking at, right? So 149 individuals we serve. Again, 69 adults and 6 children live in vehicles with transportation. 3 adults live in vehicles without transportation. 7 and 4 children live in RVs and campers. 5 adults, 1 child live in an RV with camper with no transportation. 18 adults, 2 children live in tents with transportation, and 33 adults and a child living in tents without transportation. I can't put enough of an emphasis on that. The area that we live in Mount Washington Valley, is a highly trafficked area for tourists. Living in a tent in this area without transportation is next to impossible. Jennifer had mentioned, the loss of supplies, the loss of personal items, so on and so forth, when people are found camping, and that happens here quite a bit. Next slide. So some of the challenges that we face here in Carroll County is that we have, again, no emergency shelters for unhoused populations. We do have a couple shelters that are specific to certain populations, but they don't extend to the unhoused populations, and they're not emergency shelters for cases where somebody may be coming out of a hospital and needs a place to stay, or had just been evicted from their home. We have very little transportation or access to services. In such a big area, it's hard for people to get around. I talk with people all the time trying to get from Ossipee to Conway to get mental health services or to get, medical services. We have no case management available at the way station, so we rely on other resources for case management. So case management availability is also a challenge, because a lot of the agencies that provide case management to their population specifically. We have been partnering with Carroll County Commission of Public Health and their community health worker. And she has been helping us considerably with trying to get people signed up to services that they may not have known was around, which leads into the next one, which is community resource awareness. We try to provide our clients with all of the information they need to be able to kind of get out of the situation they're in. And a lot of them are unaware of what's available to them. Additionally, a lot of agencies are unaware of what other agencies are available or what they do. And then the other challenge is agency, volunteer, and client safety training. One of the challenges that we're facing here at the way station is that we have a low to no threshold for services, which means people come to us in all conditions, shapes, and sizes. Erik had mentioned earlier that they have a vetting process for a lot of their folks. Our process is if you need help, you get help. And so that leads to some challenges in keeping client safety and volunteer and staff safety. And being able to find training courses to be able to mitigate some of the safety concerns there is a huge challenge in what we're doing. Next slide, please. So currently, as I mentioned, we have low to no threshold for services. That means, again, that anybody that comes to us that needs help gets help. The way we help them may be different. There are some folks that aren't allowed to come to our resource center, and I will meet them somewhere else. There are some folks that are able to come to the resource center, but they're not able to enter the building, so on and so forth. And we gauge that based on the histories that they provide us, the information they provide us, or readily available public information about the individual. We provide weekly outreach phone calls and text messages to all of our unhoused clients. We reach out to them each week to determine what their needs for resources may be for that week, if they're in emergency situations, so on and so forth. We have 2 days of service currently in North Conway. One of those days is by appointment. The other day is a general drop-in. And that's where, the clients would be able to come to us or so on and so forth. We currently have one mobile day of service in Ossipee, which is where I go down there and I provide services to the unhoused population down there. One of the biggest, I guess, takeaways I hope I can give everybody is that there is such a need to collaborate efforts between agencies and services available. We're all doing amazing work. And we need to, I think, find a way to come out of our silos and work together to be able to provide the folks that need it the help that they need. I know, Erik has been amazing at kind of reaching out to us and being a presence at the way station to help us do the things we need to do. I also have many other businesses and agencies in the area. As a matter of fact, tomorrow we're launching our first collaboration with Maine Health to do a women's health sign up for our female clients. We're going to have 2 female health workers available at the way station for them to come in and talk to and get signed up for free services to go in and get a lot of the screenings and things that women should be having that our homeless population generally just doesn't get. We've collaborated with other medical agencies to be able to provide vaccine clinics, etc. We also collaborate with currently 4 thrift stores throughout Carroll County where we can send clients to be able to go and get clothing, bedding, or anything that we're not able to provide. As well as other veterans resources and so on. So again, if there's anything that you take away from this presentation or whatever I'm giving, it's that the collaborative efforts need to be increased and we need to work together in order to develop a continuum across the broad services that we all provide to be able to give folks what they need. And currently, the other work that we're doing is we're working to expand into other Carroll County communities. Currently, as I said, we're only in North Conway and Ossipee, but we are looking to develop a mobile unit to go into other communities and meet clients where they're at. Next slide, please. So as I was mentioning, so we're currently working towards transitional living units. Again, that's going to be based on funding that we don't know is going to be available anymore. We'll see what happens. Circles Mount Washington Valley is set to begin its first cohort in August, which we're really excited about. There's a great group of folks. And the way that works is they're going to meet once a week in a group setting. They'll have a group meal together. It's the entire families of the people that are involved. So if it's a mom and dad, the kids come. If it's a mom with kids, she comes. If it's just one person, they show up. They all eat together, talk together, and develop next steps for them to move forward. The Financial Stabilization Fund, which is available based on need. community education and awareness, which is something that I myself and our development director do. We go out to other agencies and kind of talk about who we are and what we do. Referrals for services when requested. Again, that goes back to the collaboration, right? So we don't do much for screening, but when people come in and they're presenting in a specific way, we may, offer opportunities for them to accept a referral to something we may think is necessary. Next slide, please. So let's talk about the mobile services for a second. So we are currently, as I said, we have a mobile presence in Ossipee currently. I'm working out of my pickup truck, which isn't the best scenario, but it's working for now. We are currently looking to expand into other Carroll County communities. By doing that, we're going to be able to increase the resources that we provide to those communities. We'll be able to begin providing food, camping gear, hot and cold beverages, depending on the season. Currently, what we're providing is gas cards, laundry cards, and we collaborate with the local food pantry in Ossipee as well as the thrift store to provide the other items. The other, I think, most vital thing it's going to allow us to do is travel to individuals and encampments maintaining client and staff safety. So the way it currently works is I park in a very busy parking lot so that there's visibility on me and the clients that come to me during the daytime, because it's just me. Once we get the van, we're going to be able to have a volunteer sit in the passenger compartment because it's going to be gated. And they're going to be able to sit in the passenger compartment safe. In case any emergencies arise, they'll be able to call for help, which will allow us more flexibility in where we meet folks. We'll be able to go to them instead of having them come to us, which is going to be, again, extremely vital in this area. Next slide, please. And this is the hope, right? So this is our way station mobile service. The prospective rollout for this is going to be the first quarter of 2026. Though my board assures me it'll probably be before that. This is my hope, at least. So it's going to be, again, an extended van. It's going to be, it's going to have signage on it. Currently I'm just a guy sitting in the back of a parking lot in a truck that have a lot of people come up to me and I hand them stuff through the window and they walk away. Thank God the local authorities know who I am and what I'm doing, because that could lead to some problems if they didn't. So this, again, will allow us the ability to house food in there, camping gear. I'm going to have a desk and a couple chairs in there so that we'll be able to sit down in a climate controlled environment. So during the wintertime, they'll be warm. During the summertime, they'll be cool. We'll be able to provide, again, beverages and so on. So this came from the Cold Weather Emergency Fund 2 years ago. I was going to the Walmart parking lot in my pickup truck, and I was meeting people there in the wintertime that needed vital services that couldn't get to us. I was working with the local management at my Walmart here. Corporate didn't know anything about it, so and they were allowing me to go there and meet folks. That has since been squashed by corporate. When they found out about it, they said that couldn't happen. So we're trying to find a way to ensure that we're able to do that going forward, and this is that way. And I believe the next slide is probably the last slide. So I want to thank you all very much. And again, if you have any questions, here's my contact information. You can reach out to me anytime. Good day.
Thank you so much, Danny. Thank you to all our speakers today. It was a really beautiful program, truly. And now we will go on to our question and answer section. We have plenty of time for questions, so Maggie will be helping with that. You're welcome to raise your hand, clicking on the button there, or send your message in the chat. So Maggie, go ahead.
Thank you so much, Danny, Erik, and Jennifer. Everyone, if you want to ask your question out loud, feel free to raise your hand and I'll keep an eye out. And if you want to type it in the chat, I'm happy to direct it to our panelists.
I'll ask one.
Awesome. Thanks, Troy.
Yeah, I know Dan just kind of touched on what may be kind of like a delicate relationship with the local police. And I was just kind of wondering if maybe I could open up that question to all three of you guys to be like to maybe go in a little bit more detail about the good and bad relationships that you have that you have with police.
So I mean, I'll answer this first because the majority of the people I work with have run into the police often. I mean, it's really been kind of a case by case basis, depending on who the individual is that the police are talking with. If it's somebody with an extensive history, they may be a little less tolerant. If it's somebody that doesn't have a criminal history, they're a lot more tolerant and allowing them to stay where they are. As far as the way station itself goes, we have a really good relationship with our community for the most part, with the town officials as well as the police and fire departments. Moving into OSSAP is brand new for us. This is something we've just started over the past year, and so that's still developing. But I think as far as the relationship between my clients and the police, again, that's going to be hit or miss depending on who the individual is and what their experience with that individual has been.
I'd say from the coalition's perspective, when we did our 10 round tables, there, as Dan was saying, there was a lot of variability in sort of what we heard around relationships. And so that there are some municipalities who just have leaders, police chief or some fire chiefs who get it, who are really looking to find that balance because, like I said, it's complicated, right? Because they are there to enforce the law, that's their job, but also to be able to do it humanely. And so there was a police chief in Lancaster actually who talked about really wanting to make sure that they are able to do their job, but do it in a way that maintains people's dignity, which if I could clone him and send him everywhere, and so there are other municipalities who are building a culture that reflects that as well. Certainly there are also places across the state that we see some sort of extreme challenges in. And so like I said, our pillars are research, education, and advocacy. And so that's a space for advocacy for us. Because one of the things that we also learned was that there are police departments who are having a lot of turnover that's at least partially attributed in their younger, so first year, second year officers to things like, significant mental health, substance use disorder, homelessness, those sort of like chronic things that people they've gotten feedback that people are leaving the departments. And so for us, we have the New Hampshire, the endhomelessness.org. It's the training library in New Hampshire. And so there is a space for training we recognized among our first responders. So we're getting ready to kind of assess what space we can, or like how we can help facilitate that across the state as well, just to provide better resources so that people can be more informed, so that we can have that culture of humanity, dignity across the entire state.
Yeah, and I'll jump in. Chief Woodworth in Lancaster is fantastic, and we tend to have a fairly good relationship with most of the law enforcement in the municipalities that we work with, as well as state police. A lot of that comes from we do some training. We never, as an agency, are never involved in any kind of encampment disruption. So some of that is one-on-one training, and I also sit on a number of the region's police departments hiring boards. So I'm an interviewer for a lot of prospective new officers. So like before they even get in the door, we're having conversations regarding homelessness, substance use, mental health, and all of those things. And I think it really comes down to culture. Larger municipalities, municipalities where they've enacted, camping bans such as Plymouth, are a little bit more difficult. But I think that's a city, municipality culture versus a police department. I'm really excited. We've been trying to get into Berlin for years. Berlin is actually where our agency's offices are, like the main core of that, and the culture has not been one that we could get into, but there is a new chief of police, so I'm giving him a few weeks. He actually is good friends with Chief Woodworth in Lancaster, so we have our in there. And additionally, regionally, I attend a lot of the chiefs' meetings. So not only jail superintendents, but the chiefs across the region, so that we can have that open communication and really at times move some mountains for folks.
Thank you. Erica has had her hand raised, so we'll go with that. And then I have a few questions in the chat.
So this is for Danny. Is there a certain grant that you write, like a certain name of a grant that you write to be able to get the cell phones and the cards and stuff, or do you partner with like Straight Talk or something?
I missed the beginning of that. I think that was towards me because I think that's part of the
Yeah,
presentation. We have a very generous community here in North Conway, and we have a large population of private donors that allow us to be able to do that. We don't receive any grants or funding for that piece. One of the requests that we send out with our annual appeal is that that the donations be just for general purpose and not specific to any one thing, so that we can be more flexible with the money. So the majority of that comes from the private donors.
okay, thank you. And then Erik, this is for you. Do you have any more backpacks and tents that me and Berlin can get? I'll coordinate with you. Thank you.
Yeah, just give me a call.
Okay.
Awesome. I have another question from the chat. Francine Sullivan from Navigating Recovery. This is for Dan. How long was the process to start the mobile unit, and what steps did you take?
So with what we're currently doing, it didn't take long at all because, again, the majority of our funding comes from private donors, so we don't have a lot of red tape or hoops to jump through. We can just do the things that we find effective. So it originally began with just loading up my truck, talking with my friends over at Walmart and showing up there and letting clients know that's where I was. What we're currently doing with the van, that is going to require getting grant funding. I think the total for the van and the build up was somewhere around 78 to 80,000. And so that's currently what we're working on right now, is finding the funding for that, which again, that's above my pay grade. That's Karen handles all the money stuff, the development director. And that's pretty much that. The benefit of not accepting a lot of the higher end federal grants is that we don't have those loopholes. We don't have to, jump through all the loopholes in order to do this. We can just do what's needed to be done. I don't know if that answered your question or not, but I mean, really, essentially, it was just, talking with the board, making sure they were on board with it and doing it.
What I'm hearing is more ask forgiveness rather than permission type of situation.
With the maneuverability the board affords me, I rarely have to ask for forgiveness. Usually they know that, I have our client's best interest in mind. And when we provide a new resource or go into a new area, it is to that end. So really there's less asking forgiveness and more just informing them of what we're doing.
So thanks, Danny. Diane Aldrich, you've had your hand up.
Hi, so this is my first time participating in something like this, and I'm newly, in the last 9 months, the case manager for Grafton County's alternative sentencing. So I'm just now starting to be exposed to more and more of these issues, but my background is in law enforcement and corrections. So this question is kind of for Erik, because I was listening to your conversation of networking with chiefs of police and having those supports in place. And also for Jen, because you mentioned the 10 roundtables. So I'm thinking that had something to do with meeting with government officials in the 10 counties of the state. Is that correct? Possibly?
Sorry, couldn't find my mute. So they were open to the kind of anybody who was interested. And so it was kind of a mix of community members, municipal leaders, people with lived experience, so service providers, kind of you name it. And so it was kind of a different mix depending on which roundtable you were talking about. So, yes.
So because I'm wondering now, of course, I went through the police academy in 1993, so I'm dating myself a little bit, but I know at that time this really wasn't a topic that was taught or promoted to be supported. Are there networking efforts in place now to try to garner that support in that area? If that seems to be, obviously there's a lot of issues with substance use and mental health out there, no matter what part of the spectrum you're in. But I think the more support that you can get in each corner, especially with law enforcement and the smaller departments, maybe the better. Do you have recruitment efforts to get people on board with these different groups?
So not necessarily recruitment efforts, but I can say, so in the past 10 years, there's been such a shift in law enforcement as a whole. You even just in terms of like law enforcement mental health specifically, so that leadership, your chiefs of police are much more likely to embrace their officers getting support, but also those over the last number of years when we've heard people talk about defunding the police, those activities about bringing social work out, we've been doing up here for years. I can't think of the word, but just we didn't call it that, but that's what we've been doing, where it's like, hey, maybe I'm not the right person to talk to this person right now. Would you mind coming down? And so we do a lot of that. We do a lot of, like, hey, I have probable cause to search this person. How do I do that, but also maintain them with dignity? And that's something that even, especially the younger officers, are really, really motivated to work with. I see a lot of them also being the best at referral. So identifying somebody's need in their interaction and that's something that there really isn't necessarily like one set group, but I think both the tables that Jennifer did, and then the recent SIM mapping endeavor that the state did, both of those things together have done some really wonderful work at all levels of law enforcement. So one of the things that I'm really proud of is the jail up in Stewartstown in Coos County here recently launched their summit program, which is really great rehabilitative work for the folks that are in there, but also anybody who's in there even for the weekend is being connected with resources, SUD, mental health, otherwise, so that when they're leaving, they're being left with a ticket to the next positive step for themselves. So yeah, we're a lot better off than I think we used to be, but we also have a long way to go.
I will say from the macro perspective, so the New Hampshire Council on Housing Stability, Drew Holmes, who works for the Department of Corrections, and I can't remember his title off the top of my head, and I apologize. But so he sat on a work group, a criminal justice work group. So it was Drew. There were a couple of people who were former Granite leaders with lived experience who were really looking at the impact of having a criminal conviction or an incarceration and the intersection with homelessness. And so I know that he is really looking at improving transitions out of incarceration in New Hampshire, so that there's some great work being done on that kind of at the state level. And then locally here down in Manchester, I know that the overdose prevention team that I was talking about earlier, Andrew Warner with the city, is working within the jail. So Hillsborough County House of Corrections, or Valley Street, if colloquially here, so that there are some great works that are happening between corrections and sort of trying to limit the impact of that with homelessness. So.
Thank you. I have a question in the chat from Emma Seamer at Keene Serenity Center. This is for all three presenters. Do you have any advice as to how organizations should assess that their programs are still meeting the needs of the unhoused population that they're serving?
So I can speak to that. So I would refer you back to those two documents that I had in my slides. And so both the U.S. Interagency Council and the National Alliance both have really great website stuff on their website about how sort of like systemically you can take a look at that. So making sure that your organization's policies align with the direct service work that you want to do. And then an evidence-based practice is making sure that the work that you do is housing related, like so making sure that you're working on housing issues. And again, going back to that harm reduction piece as well. But there's some really great information on those two websites.
Thank you.
I know, it's a little bit different for me, I suppose. I listen to the clients and what their needs are, and then I bring it to the board. The brain trust I have at the way station between the clients and the board has been amazing. It's helped us to develop growth with the programs and the services and resources we provide, as well as to kind of stop things that were not effective. So for me, I think, but for the way station, we really rely on our clients to give us that feedback. We do that through the weekly outreach calls as well as the one-on-one interactions we have with them when they come to pick up their resources.
Yeah, and I would just follow up with saying, look at what it is that you set out to do. I think over time some things we find may not, something that was a need at one point might not be needed after a while. Used to be a lot of HUD funded transitional housing in the state, and then that has gone away in favor of more localized programs, which I think are better suited to meet folks' needs. I think, and like Dan said, listen to the clients, but also look at, what do you have the capacity to do? Is the shift that you're looking at within your scope, or is somebody else already offering that next door? Duplication of services is such a waste when we all have such scant resources sometimes. And so that goes back to what Dan said about, collaboration, and maybe there's something within your wheelhouse that you could just as easily offer as what you're offering now that is still within your capacity, but maybe has better outcomes, or I think going back to the drawing board there's always value to kind of reassess. One of the things I've really enjoyed as a director is I've done all the other roles in the department. So when I got here, I'm like, we're not doing this anymore. They're not asking for that, so we're not going to ask for that. And so removing unnecessary work on staff and participants' parts to make things run smoother. Even outcomes like that out of that kind of self-assessment has value. So even if you don't change anything, it's worth looking at.
Thank you so much. We are running up on our time limit. I have one more question in the chat. Melissa, do we have enough time to do that? Okay, thank you. So this is from Latanya, and it's for Dan. In your presentation, you mentioned children living in vehicles and tents. What is the role of DCYF in those instances? Do they collaborate with your organization to get those individuals housed, or does municipal welfare provide any motel options? We have multiple encampments in Nashua, but we are fortunate enough to have local family shelters.
That is such a great question. It really is. And it's one of the biggest wintertime challenges we have. So again, we do not provide case management at the way station, so we don't have the ability to walk with our clients through that process. The only thing we can do is provide them information for a surface referral to reach out to other agencies. We don't have the ability to do the colloquial warm handoff to another agency. So whenever we have a situation like that, we do try to connect that individual or that family to services through the local municipality, the town welfare office, TRICAP, etc. We really don't have a lot to do with DCYF unless the client asks us to. Again, we have a low to no threshold, which means that we really don't do a lot of screening, and we don't do a lot of outside collaboration unless it's the client's request. But that is a great question, and it's something that we're constantly working on. During the winter with the cold weather fund, we're able to work with hotels. We had one mother and young child who we put in a hotel for the majority of the winter last year. We were able to make that happen, but we're not always able to make that happen. So we do rely on the town as well.
Thank you so much, Dan. That is the time for Q&A, and I'm going to hand it over to Brooke to close us out. Thank you.
Thank you so much, Maggie, and thank you all of our great speakers today, and to all the participants as well for the great questions and being a great community here. Please remember that you can visit nhtac.org to view past communities of practice, recordings, and receive other resources. We've left the link for that in the chat as well. And very important, please do not forget to complete this brief survey. The link is also in the chat, or you can scan the QR code there. Please make sure to leave your name on the evaluation to be sure to get CEUs toward this certificate, and it only takes a few minutes. That's all for our final announcements today. So thank you all and have a wonderful day, everybody. Until next time.
Thanks, everyone.
Bye.